Hi everyone, my name is Dr. Khan. I'm from Montefiore Medical Center, New York, and today I'm going to discuss about role of exercise and physical activity in managing metabolic dysfunction associated steatohepatitis. I know many of you might be here because they themselves or their loved ones might be suffering from the condition and they want to learn more about it. That is why I'm going to try to simplify the terms in it. In order to understand the above, let's take a step back and understand what exactly is MASH and what leads to it. Think of our liver as a factory that processes the nutrients in our diet to keep our bodies running, and it stores the extra nutrients as fat. Various risk factors, you can say, like dyslipidemia, which is a lipid imbalance in our body of cholesterol and fatty acids, diabetes, obesity, and as well as alcohol can lead to excessive fat deposition in the liver cells, leading to a condition called fatty liver disease. And if we rule out the excessive alcohol use in a person, we can safely say that the person having fatty liver disease might be having it because of the other risk factors and is called metabolic dysfunction associated steatotic liver disease. Our liver has like an extreme capacity of repairing itself, but in the process of doing so, it causes scarring, which is called fibrosis. And if the above conditions like diabetes, obesity, and dyslipidemia goes on unchecked and are not measures are not taken to correct them, then our liver might suffer excessive scarring and leading to a condition called cirrhosis. So, what are the signs and symptoms of MASH? So most people with MASH would not have any symptoms at all, but sometimes as the condition progresses, patients will start feeling fatigued, weight loss. They'll have abdominal pain, especially on the right upper quadrant of their abdomen. They'll have yellowing of the skin, also known as jaundice, and they have yellowing of the eyes as well. The liver might get enlarged due to the fat deposition, and those are some of the symptoms that you can see in patients suffering from MASH. Now, how does a physician diagnose someone with MASH? There's several blood tests that can help us recognize the conditions that are described above, such as lipid profile, then liver function test will be elevated, then you can check hemoglobin A1C to see how the sugar levels in the patients are. Then then we have various scores like fibrosis assessment test scores or fibrosis 4 score. Then we have various imaging modalities like ultrasound, we have CT scan, we have MRI of the abdomen, and then we have ultrasonic elastography or MR elastography. The gold standard for diagnosis is the liver biopsy. Once we have made the diagnosis of MASH, then we can go towards treatment, how to treat it. Usually, the treatment of MASH involves a combination of lifestyle changes and managing the underlying conditions that can increase the risk of MASH itself. Number one thing you can do is losing 5 to 10% of your body weight. Then you have to have a tight glycemic control, which means tight sugar control in your body. Then you have to have a tight cholesterol and triglyceride control. Then you have to have a very balanced diet with the fruits, vegetable, and whole grains. But the number one modality which we're going to talk about in detail today is moderate or high intensity exercises that you can do in order to bring down the risk of getting MASH or controlling MASH. So let's now talk about various exercise modalities and physical activities that can help in managing the risk factors involved in MASH. Let's start with the cardiovascular exercises. So cardiovascular exercises not just help with the total promotion of cardiovascular health itself, but can also positively impact the metabolic factors associated with MASH in the following ways, like doing brisk walking, or swimming, or cycling, or running individually, or in a combination, can help you reduce your body weight, can help you reduce your cholesterol level, and can also help you with the increased insulin sensitivity on your cells itself, which will ultimately lead to the reduced inflammation of the liver cells and help controlling the MASH. For patients who have the excuse that they have a very busy lifestyle and they are unable to do these exercises on a regular basis, high intensity interval training is a very attractive modality in controlling MASH. In this type of training, you do 8 to 10 exercises like jumping jacks, squats, high knees, skipping, push ups, burpees, or lunges in 10 to 15 repetitions for a total of 150 minutes weekly, and it has shown to slow the progression of MASH. In conclusion, we can say that a combination of cardiovascular exercise or high intensity training, along with a very good healthy diet with fruits, vegetables, and whole grains, can lead to the control of MASH in an effective manner. Thank you.